Make a big policy announcement on the NHS at his party's spring conference later. He will say that a future Conservative government would make hospital services available 7 days a week by 2020. Now, Labour says that people won't believe the promise, but the Health Secretary, Jeremy Hunt, told Breakfast that services should be available at convenient times for patients, not doctors.
People who've worried about safety in the NHS will be very excited, because we would actually be the first healthcare system anywhere in the world to say that, illness happens 24/7. People are born 24/7. People have heart attacks and strokes 24/7. And we need that full consultant cover every day of the week, not just times when it's convenient for doctors.
Our political correspondent, Carol Walker, is with us now. Carol, you saw the conversation we had with Jeremy Hunt and the announcement that's expected. There's a question about funding, though, isn't there, about where the money will come from to provide these services?
That's right. I think everyone agrees that this is an important issue. People know that they don't get the same service that they would like at weekends. We know that mortality rates are higher for patients who are admitted at weekends because they don't have the same consultant cover, they don't have the same diagnostic backup. But the question is how they're going to pay for it. Now, Jeremy Hunt was saying there it's going to come from the £2 billion, which the Conservatives have already announced is going to be coming on stream this year. That's an extra £2 billion a year. But we've already heard from the BMA, the Doctors Association, this morning, accusing the Tories of playing games with the funding. They are saying that that £2 billion is not even sufficient to fill what he called a huge funding gap within the NHS. It's not even sufficient to cover all the services which they're already providing. And there is absolutely no new money to make sure that you've got the staff and the facilities available at weekends as well as during the week. So I think that is the big problem. It's certainly something which is important to patients, and medical practitioners agree it's something that should happen. The NHS is already working on a plan to try to introduce this, but the question is how the hard-pressed hospitals are going to pay for it.
No coincidence, of course, that the general election is just around the corner.
Indeed.
Carol.